Hello everyone. Today we'll be talking about ECG changes in left ventricular hypertrophy. So there are three basic criteria which are described to define left ventricular hypertrophy. It is first is called as Sokolov-Lyon's criteria, Romil-Testis point score system, and Cornell voltage criteria. Let's go through it one by one. Sokolov-Lyon criteria is the most commonly used criteria. It is defined as S wave, the depth of S wave in V1. That is the depth of S1, the S wave in V1. So this is the depth of S wave in V1. Okay, so we will calculate the amount of duration of amplitude of this S wave. That is, each small square here is 1 millimeter, and so number of small squares we will calculate how much it comes to. And this S wave, if we add to the tallest R wave height in either V5 or V6, so this is the R wave in V5. This is R wave in V5 and R wave in V6. So here also we will calculate each small square is 1 mm or 0.1 millivolt. So we'll calculate the height of R wave here, amplitude of R wave here, and S wave in the V1. So if the combined, if it is coming more than 35 millimeters, it is fit into the criteria of left ventricular hypertrophy. Second criteria is the Romil-Testis point system. So it includes various criteria and it gives points to each of them. So first one is the amplitude. So in any of the limb leads, so first thing is this largest R or S wave in any of the limb leads if it is more than 20 millimeters. So what do you mean by limb leads? Limb leads are all this 1, 2, 3, AVR, AVL, and AVF. In any of this 1, 2, 3, AVF, AVR, AVL, AVF, if any air, if the duration of R wave, this is the R wave, or the duration of S wave, so amplitude of R wave or amplitude of S wave, if anywhere, if it is more than 20 millimeters, that is, if it is coming to be more than 20 small squares anywhere in the limb leads, it fits into the criteria of the left ventricular hypertrophy, and we give a point as 3. So either of the one of three, these three should be present. The second thing is S in V1 or V2. So S wave in V1 or V2. So this is S1 in V1 or V2 if it is more than 30 millimeters. That is, more than 30 millimeters means 30 small squares or 6 large boxes. If it is fits into more of them, is called as V1 or V2. If it is more than 30 millimeters, then it fits into LVH criteria. The third is R in V5 or V6 if it is more than 30 mm. Again, R wave in the V5 or V6 anywhere if it is more than 6 small squares, as you can see here easily, 1, 2, 3, 4, 5, and 6 small squares, 6 large squares or large boxes are included here. So if any of that comes, any of these three things is present, we give a 3 point. Second thing is if there is associated left atrial enlargement, we give 3 points. If there is ST depressions or T wave inversions in any of the lateral leads such as V5, lateral leads include V5, V6. You can see here ST depressions with T inversions is there in V5 and V6. If that is there, so ST depression or T wave inversion in lateral precordial leads, it gets 3 points. If any left atrial enlargement is present, it's given 3 points. Left axis deviation, if it is present, as you can see in this ECG, there is left axis deviation, you give 2 points. If the QRS duration, so the duration of the starting of the Q to the end of the S wave, if it is anywhere, it is more than 90 milliseconds. 90 milliseconds means around more than 2.5 small square. If it is more than that, that also is a criteria in the Romil-Testis point system, and we give it as 1 point. Other thing is the intrinsic or deflection in V5 or V6 more than 50 milliseconds. Intrinsic or deflection is nothing but is the maximum peak point, peak duration of the R wave. So from the initial of the QRS to the peak of R wave, the amount of time which is taken for this intrinsic or deflection, this duration, if it is more than 50 milliseconds in V5 or V6, we give it as 1 criteria. So after adding all these points, if the score is more than, if score is 4 or more than that, it comes into probable LVH. If it is 5 points, definitely it is called as definite LVH criteria. So this is Romil-Testis point system. Last one is the Cornell voltage criteria. Cornell voltage criteria says that if the height of V3, that is amplitude of S wave in the V3, and amplitude of and if you combine it with amplitude of R wave in the AVL, if it is more than 28 millimeters in men or more than 20 millimeters in women, this is called as criteria for left ventricular hypertrophy. So as you can see here, R wave in AVL is around here 9 millimeters and S wave in V3. So AVL and V3 you should see, S wave in V3 is around 20 mm. If it is 29 mm. So in men, if it is more than 28 mm, it is called as it is fits into the criteria of LVH. In females, it is more than 20 millimeters. So this is the 3 criteria: Sokolov-Lyon's criteria, Romil-Testis point score system, and Cornell voltage criteria. Hope you have liked this video. If you want more video like this, do subscribe to my YouTube channel, Dr. Akif Baig. Thank you.